Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, along with my nursing student, Gina Peter. And today we're talking about back pain. I'd like to welcome to the show Dr. Donelson, founder and president of SelfCare First, and the author of many books, including Rapidly Reversible Low Back Pain, an evidence-based pathway to widespread recoveries and savings. Dr. Donelson, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
It's a pleasure to be here.
So first, I have to start out by asking you, how are you doing during this COVID season?
I'm doing quite well. I fortunately live in Colorado where things are calmed down quite a bit, but we're doing social distancing and wearing masks,
yes,
all the usual precautions, but feel quite safe, and we're out and about doing things, so we're not too handicapped by this at this point.
Have you been personally affected by it at all?
Not really.
Oh, good. Okay.
We've been able to keep our distance, and likewise our family and friends, so we've been able to get out and socialize a bit with our friends, but mostly we keep our distance.
Can you tell us a little bit about yourself and how you got into medicine?
Well, I'm an orthopedic surgeon by training, and I started my career with an interest in sports medicine. But very early, I was introduced through a physical therapy friend of mine to a type of spine care, low back pain care, that was intriguing. And I saw my patients doing some unusual exercises prescribed by this therapist, and they were turning around quite quickly, and that was intriguing. So much so that I started to learn more and more about it and was further impressed and realized that this was very important because low back pain is quite an enigma in terms of what causes it and how to best treat it. And this particular type of care that I was introduced to seemed to address many of those problems. And so I realized its importance, and over time I became more, really compelled to get into it a bit more. And I got into it in a big way in that I changed from sports medicine to spine care and from surgery to non-surgery, and went from a small town New England private practice to academic medicine to do some research and scrutinize this type of care a little more thoroughly. So for many years now, I've been a non-surgical specialist in spine care, and that's what all the books that I've written are about, and I've published a number of research studies and so forth. So I'm a real advocate for this particular type of care, and I think that's really what brings us together today.
So just to back up, how do you diagnose if there is an issue with the spine? What are some of your diagnostic tests that you use?
Well, the literature would tell us that we're unable to diagnose 80% of low back pain. We don't know what causes it. And that, of course, opens the door widely for whoever is treating a low back patient to use whatever treatment they want and justify it, often just because they found it works in some people. What is available diagnostically is the conventional clinical examination that a doctor would do in the office, and then it's, of course, common to do some MRI imaging looking for the cause of the pain, and that's where the problem lies, because the cause of pain either doesn't show up on an MRI, or we misconstrue some things on the MRI thinking it's the cause of the pain, and it really isn't. So there's a lot of misdiagnosis, and it really comes down to the inadequacies of our diagnostic process. And that's what specifically intrigued me about this new type of care that it's not new now. I've been doing it for 30 some years. It provides a form of assessment that isn't imaging. It is clinical testing, where you actually have the patient do some spinal bending tests, and you monitor the effect of those tests on the pain. And we monitor whether the pain changes in its intensity as a result of a particular type of movement or changes its location. And what has been learned and thoroughly documented in the literature is that most people have a single direction of spinal bending, that when they do it repeatedly, it starts to eliminate their pain. And that elimination is typically in a specific pattern where the most distal pain goes away first, and then the elimination of the pain moves proximally. So many people have pain all the way to their foot. We call it sciatica, or all the way to their hand. And those most distant symptoms go away first, and then the pain moves proximally, goes away proximally, until finally there's only the midline pain left, and then that goes away. And so for most people, and this is when I say most, the literature would say it's from 70 to 90% of people have a single direction of movement when they perform it fully to the end of their range, and do that repeatedly. It starts to eliminate their pain. And when that starts to happen, we know that we have found the answer to their problem, because those people typically get better quite rapidly once we identify that initial direction of movement. And we call that direction the patient's directional preference. The cause of their pain inside prefers that direction of movement, and that's what enables them to begin to recover. And then the recovery really typically goes quite rapidly once you do that diagnostic process at the outset.
So in your experience, what do you think is the most common cause of most back pain?
I would answer it a couple ways. One, if they have this type of response, which, as I said, is 70 to 90% of people, it doesn't matter what the cause is. We've just found how to solve it. And, it begs the question, well, what's going on in there? Why is the pain responding this way? Why does it recover with a single direction of movement? And the most likely answer to that is that it's a disc problem causing the pain. Because when pain changes this rapidly as a result of mechanical movements like this, it's probably something that is out of place that's causing the pain. And if you find a direction of movement that puts it back into place, the pain goes away quite rapidly. It's what we as orthopods see when someone dislocates their shoulder. It's a very painful thing. And if you can find the right way to move that shoulder, the right direction and so forth, and it pops back in, suddenly the pain is relieved and the motion comes back. So the way the pain pattern behaves suggests that it's something that's out of place. It went out of place and it's causing pain, and if you can find the direction of movement that it puts it back into place, the pain is relieved and the recovery comes quite rapidly. And so most often that specific direction of movement that helps is a backward bending movement, an arching of the back. Most often helpful by lying on the floor face down and doing like a cobra in yoga, and pushing the top half of the body up and letting the lower back sag maximally, and doing that repeatedly. That helps a lot of people just doing that. So a backward direction is the most common subgroup. Some people have to move sidewards, some people have to go forwards, but those are much smaller groups. And that's likely because most people, their pain is a result of doing a lot of forward bending stuff. Whether it's sitting at a computer all day or an airplane ride or working in the garden, it's a forward bending type of thing. And that moves something out of place that needs the backward direction to put it back into place. But people don't know to do that. And that's not the direction for everybody. So that's where the assessment comes in, to take a patient through these different directions and movements to determine, is there a direction that corrects the pain and starts to eliminate it? And if so, what is that direction? And then that, when that is revealed, that then becomes a tool that they can use to eliminate their current pain. And also, if the pain starts to return, they can use that same tool to keep it from becoming any kind of an episode again.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, along with Nassau Community College nursing student Gina Peter. And today we're talking about lower back pain with Ron Donelson, founder and president of SelfCare First, and the author of many books, including Rapidly Reversible Low Back Pain, an evidence-based pathway to widespread recoveries and savings. Would you classify this as a therapy?
Well, most of the clinicians that provide this type of care that are trained to do this are physical therapists, but there are a lot of chiropractors that are training in it as well, and some MDs are getting trained in it. So it has grown out of the physical therapy world, but it's not limited to physical therapy at all. And so I hesitate to call it physical therapy, although that's not an inappropriate label either, given that that's the type of clinician that provides it. I think a more important description of it is that it is an assessment, unlike most physical therapy, which are treatments. And when we discuss low back pain, we talk about, well, what's the best treatment for low back pain? Well, my answer is it depends on what kind of low back pain you have. And that's where the diagnostics come in, because if it's a problem that is solved by this extension, this backward bending movement, that's one type. There are other directions, but there are also types of back pain that don't have a directional preference to them. They need something else. So the diagnostics is what's important, and mechanical diagnosis and therapy, this type of care, its foundation is the assessment to determine, is this something that can reverse rapidly? Is there a directional preference to it? If not, then you need to go on to something else. But most people have those characteristics, and that makes them easily solved once they are assessed properly.
So what does this look like? Coming in, being diagnosed based upon some kind of bend assessment, and then starting therapy in the office that day based on your assessment and sending them home to come back for another session, or sending them home to do it themselves?
A little bit of both. I mean,
Okay.
Once you identify the type of pain they have, and if it's a type that has a directional preference, then you teach them. Then the therapist becomes a teacher, a coach, to show them how to perform the movement that just eliminated their pain, how to go home and do it, when to do it, how often to do it. And then you want to see them back typically in the next day or two to be sure this is working, to confirm that you're on the right track and that they're doing it properly. And so often within 2 or 3 visits of them doing it at home, they're well on their way to recovery. And so it's very important to see them back to make sure they're doing it properly, to do it frequently enough, and to be making progress in eliminating their pain and restoring their full movement to their spine. So typically, if a person is seeing a physical therapist, say, for this kind of care, it at most is maybe 3 or 4 visits. The first couple are to make sure that you've got the right answer to it. But then the last couple are how to prevent the problem from coming back, how to go from getting rid of it to preventing it. It's the same tools, but you'd have to go from being proactive in getting rid of the pain, to be reactive to get rid of the pain you're having, to being proactive to prevent it from coming back. So some simple things that you can do using these directional principles will keep the pain from coming back. Or if it does start to come back, you know immediately what to do to prevent it from becoming any kind of an episode. So the last at least couple visits are all on the preventive side because we've already gotten rid of the pain. So there's more to it because low back pain is so often recurrent and people have episodes and episodes. we want to make sure the patient is equipped to prevent the episodes from returning, or to nip it in the bud if it starts to come back right away. And so that's all incorporated in the initial treatment.
Has this been compared to surgical intervention? Has there been anywhere in the literature where it's compared to which is more effective?
Well, one of the interesting things regarding that question is there are several published studies of patients who have had low back pain to the extent that their treatment has not solved their problem, so they're considered surgical candidates. And at that point in their care, in these studies, they were given the opportunity, finally, to undergo this type of assessment. And those studies collectively indicate that half of the patients who are surgical candidates will have this type of pain response when they're assessed. And they have a directional preference, and they can quickly recover from their problem rather than undergo surgery. And there's some other data that suggests that half of the low back pain surgeries in the U.S. every year are unnecessary. And so this gives us a tool to determine before surgery who can recover, who doesn't need surgery. The problem is that so many patients that undergo surgery are never given the opportunity to have this assessment. And so they go ahead and have their surgery because they're looking for a solution. But in fact, the solution, the best solution, was something they could do themselves without any need for surgery. And so that's probably the most important point on this regarding surgery and how this relates to surgery.
So can back pain stem from a problem elsewhere in the body?
Back pain can be from many reasons. You can get back pain from an aneurysm, from a kidney problem. Things internally can cause back pain. And of course, if you put that patient through this assessment, they'll never have a directional preference. Mm-hmm. There's no direction of movement that's going to change an aneurysm or a kidney problem or an infection or anything like that. So those people are identified. They're sorted out very quickly with this type of assessment. The other side of that same question is there's a lot of things in the periphery of the body that are painful things that are not recognized as coming from the back. And so there's several studies of shoulder pain and hip pain and knee pain that show that when you do this assessment of the spine, many of those problems disappear because they're actually coming from the spine. And so an MDT clinician, mechanical diagnosis and therapy clinician, when they're presented with a patient with a shoulder, hip, or knee pain, they are trained to always, what we say, clear the spine first. Do a quick examination of the spine to make sure that pain isn't coming from the spine. And the published studies show that about 40% of those patients have a spine problem. They don't have any spine pain, they just have shoulder pain or hip pain. But when you clear the spine, when you evaluate the spine in this way, you find out that up to 40% of them actually have a spine problem, and it's very rapidly fixed because they have a directional preference of the spine. And that eliminates their extremity pain. Mm-hmm. Those same studies, once you clear the spine and get rid of that group, and you're still left with people with persistent shoulder, hip, or knee pain, if you then take their shoulder, hip, or knee through a series of repeated movements, looking to see if there's a direction of movement, if you do it repeatedly, that eliminates the problem. And another 30 to 40% will have that finding in their extremity joint. So that means that of patients that come, say, with shoulder pain, 70% or more have a directional preference. But half of those people, the directional preference is in the spine. The other half, the directional preference is in the shoulder. But that's a totally different way of assessing shoulders than what you'd get in the average orthopedic office or in the average family practice office. Mm-hmm. And so this is very important stuff that these clinicians don't know about yet. So part of my work is trying to teach those clinicians about this, just as we're discussing it for the benefit of the public and patients who are struggling.
So what are some of the best ways that one could prevent lower back pain and spine issues before it becomes something that would land them into your office? Well,
one of the chief problems is our sitting, and specifically our sitting posture. consider that if so many people get benefit from bending backwards, we talked earlier about how their pain is brought on or aggravated by forward bending. Forward bending can be just slouching at the computer all day or a day in the car or whatever. It can be from working the garden, shoveling snow, piling wood, whatever, bending activities that are repeated or persistent. That it can bring on back pain a lot of people. And of course, once it comes on, then they don't always pick up that was what caused it, so they keep doing it. And say, it hurts, but I got to get this done. Well, explain that to your back, how important it is to get whatever it is done. And so it's said that sitting is the new smoking. And there's lots of reasons. There's lots of other reasons where sitting is a problem, but back conditions are a huge problem. And so sitting more erectly, putting what we call a lumbar roll, a little support, a pillow across the small of your back to help deepen the hollow in the back, so that when you're sitting, you're more erect, closer to what you have when you're standing. And a lot of people with low back pain say, boy, I really get in trouble when I sit for too long, but I feel much better when I'm up walking around. So I get up and walk, and that's very helpful. Well, if you consider the position of the back, sitting versus standing, we're worse with our spine bent forward, and we're better when we have a hollow in our back, like when we're up erect sitting. And of course, we can, for many people, they get much more benefit if they take that hollow to the extreme with a cobra, like we discussed, or just standing up with the hands in the small of the back and really bending back fully and doing that with some repetitions. That in itself can be very helpful. And so a lot of people can benefit just from that simple information. And so they don't always need to go through this full assessment. But this type of assessment, this directional testing and so forth, is far more informational, far more helpful than the normal clinical exam that your doctor would do, certainly more informative than an MRI. Because an MRI, there's a lot of people, a high percentage of people that have herniated discs on their MRI and have degenerative changes in their discs, and they have no pain. They happen to get the MRI for some other reason, and they have all those findings, but if they happen to have pain, those findings would be blamed. And then the attention goes, well, how do we fix this thing on the MRI? And then, well, we could do this operation, whatever. And in fact, all they need is a directional assessment, and they have a solution. They don't need to go through all that. So once you get an MRI and you start spotting these things, then things get off track, and a lot of things that are not helpful to the patient occur. And sometimes they're detrimental to the patient. They can cause problems.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, along with Nassau Community College nursing student Gina Peter. And today we're talking about low back pain from Dr. Ron Donelson, founder and president of SelfCare First, and the author of many books, including Rapidly Reversible Low Back Pain. I heard about the body mechanics, using correct body mechanics, and how we should stay erect without posture. Is there any way that we can build muscle in our back? Exercises that we can do to prevent, bad, poor posture?
Yes, of course, there are ways to build up strength in our lower backs, and we can get that from any trainer. We can go online and learn about strengthening exercises for our core, for our lower back, and so forth. The bigger question is, what difference does that make in spine problems? One of the common treatments for low back pain is strengthening, which I think is behind your question. But there's very little evidence that strengthening the spine alone, strengthening the musculars in the trunk alone, is that helpful in eliminating a back problem that's existing. And so there's far, far more evidence of the type of mechanical intervention that I'm talking about. So core strengthening and so forth is very popular. There's a lot of belief out there that muscles are the issue and that strengthening the muscles, therefore, are the solution. But the evidence for that type of care is not very strong.
Interesting.
And for all the evidence that this mechanical intervention is so helpful.
Mm-hmm.
Those people don't do any strengthening to recover. So it's not an essential need. Yes, it's a good thing for all of us to strengthen our core, just for general health and activity and so forth. It's a very recommended and healthy thing to do. But to focus on that as a solution to back pain, first of all, misses the entire mechanical explanations for these problems and the solutions that are there.
How do we get in touch with you? How do we access this type of care? And how do we know that practitioners are literally doing this kind of intervention, not jumping to surgery, but we want to do this mechanical diagnosis and therapy?
There are a lot of therapists and chiropractors who claim to know this type of care, but they're really not fully educated, and so they don't deliver it well. There's far more clinicians who know nothing about this type of care. Most doctors and surgeons, for different reasons, don't prescribe this type of care. So it is important for the patient to kind of seek it out to make sure that they are accessing it. I think the best help would be available on my website, selfcarefirst.com, where there's information. And there's several videos and presentations that include how to find someone. And there are several ways of doing it. There's a website, the McKenzie Institute happens to be the group that educates all the therapists and all the chiropractors in this type of care. And they have a database that people can access to see who is trained in my area. And so that's McKenzieInstitute.org. And you can go there and click on the USA, because it's a website that covers many 30 or 40 countries. Click on the USA, and then it asks you what state are you in and so forth. So you can try to locate someone in your area that is trained. There are some other ways of accessing this type of care. It's very amenable to virtual care, but that still has to be directed by someone who's trained. And but virtual care is one way to access it. There's another group that has an app, a free app called Joint Strong that takes a person through this assessment. They can self-assess and whether it's back, shoulder, hip, knee, any of the joints. So I would say to sort all this out, I try to give as helpful a response to this question on my website, selfcarefirst.com. And there in the videos, I address it.
Well, we look forward to looking at that website. And thank you so much for being here. Ron Donelson, founder and president of SelfCare First, and the author of books including Rapidly Reversible Low Back Pain, an evidence-based pathway to widespread recoveries and savings. We hope you stay safe and continue this great work that you're doing.
My pleasure, too. Bye-bye. This
is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, along with nursing student Gina Peter. And we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.